We have to perform different things for every individual. Like as I was mentioning, the capsula is very important. After the explantation, the capsula must be excised. And the other step is lifting the breast. There are different techniques. We can sometimes use the classical breast uplift surgeries like that with the reverse T and lollipop incisions. This may be necessary if the patient has extra skin. But for those people who don't have extra skin, a very large and saggy breast, we can also do the internal bra lift. So with
This is what you
stitches,
did with me.
yeah, with some stitches, using some stitches and specific dissections in between the pectoralis muscle and the breast, we can lift the breast up with some limit. So this was necessary and also enough for you. And we also added some volume with the fat grafting on your breast for some specific areas and different layers to achieve a better fat graft survival. Because some of the fat is decreasing after the injection, and we must be able to survive as much as we can. And so we are using the correct crisscross techniques in different layers of the breast and the pectoralis muscle. So this was really important for us, and we already performed this for you.
Yeah, and it's definitely survived.
Yeah, and we were talking about the fat grafts before this conversation, and the main question was about the volume and the behavior of the fat grafts in the injection areas. So we will also talk about this. So during the surgery, the technique was like with a small incision, internal lift with some specific dissections and the stitches, and also the fat grafting for you. But as I was mentioning, for some other individuals, some other surgical maneuvers may be necessary, and some extra incisions may be necessary.
So you basically can completely customize the approach with explant and restoring the breast based on each individual case.
Yes, actually yes, because we are doing an aesthetic work. Just the explantation is not enough. It doesn't give us an aesthetic look, so we have to customize everything for that.
And it's something I really liked, that you understood I wanted to achieve a result without putting another implant in, because some other surgeons I consulted with were very keen to put a smaller implant in, because I was telling them that I didn't like it. It felt too, fake for my personal taste and how I felt. But I also was explaining I didn't want implants, but for them, they were telling me like, you should just put a smaller one in. But you said you understand I don't want them, and you had another way to achieve, the result I wanted, which was, to me, so that was like a big green light when, you said this. And when I met you in person too, you said like, you understand, it's just not for me anymore. And I was like, yes, he understands.
Oh, good. Yeah, this is the good point for me, because when you believe I understand you, it comes to me.
Yes.
So this means that we are gonna walk a good way with you. So this is all about the surgery. The main note at this stage is this type of a surgery is customized surgery, because everybody has different breast shape, different implant types, different implant location, like under the muscle, over the muscle, and some other things. That's why you can discuss this with your surgeon. It must be discussed what kind of surgical maneuvers you need and what kind of surgeries you need. This is not just explantation and closing it, stitching it. So this is much more detailed. And after the surgery.
Yeah, after the surgery, I was definitely nervous still to see. I felt confident in the process so far and what was agreed upon, but of course, you still feel a lot of nerves about like when you're gonna take off this compression bra and what will it look like. So I can remember that moment Actually, I can remember first you told me like to touch the breasts, and like it was so soft.
Yeah.
Because I had my implants for 10 years, like a decade. I forgot like what it will feel like otherwise. And anyway, so I was like, wow, it feels so soft and natural, which was really nice start. And then when I looked, I was really surprised. It was much better than I thought. Um, of course, it's a process, and to begin with, you're gonna have a bruising, swelling. Like, you have to be realistic. You're not just gonna wake up with the perfect like breasts you want back. But even with all the trauma that was still showing in the area from the surgery, I could still see like, wow, my breasts are not sagging. The scar was really not very visible. This is another thing I was worried about, that it would be much more noticeable, but honestly the scar looked almost the same as before. So I noticed you must have been able to just open the existing scar, not make it any bigger. And however you stitched it back up, it was like amazing. It was better than the first surgery, the scar.
Oh, yeah.
Seriously?
We have less tension actually. Of course, we are doing everything to achieve a better scar, but also the nature of the surgery has some effect on it. So when we are doing the implantation, it gets very tight, and this pull may delast your scars. So I cannot judge your previous surgeon. This may happen.
The scar was still
must be
fine,
upset.
but yeah, I think it's just overall all the concerns that I had were really mitigated from the beginning, even though I was still in the process, which would take, many weeks and then even months to get to your full result. Even from the early days post-op, I felt really great about the aesthetic, but much more than that, I felt so free that I finally did this, a procedure I'd been wanting to do for so long. And just actually doing that and coming out the other side was very transformational for me. I felt a lot more like myself and a lot more confident in myself. So yeah, it was altogether really, like, I would say, a life-changing experience coming on that trip to Istanbul. Going through the surgery, yes, it takes a lot of courage, both like mainly just mentally. You have to be prepared that you will some days not feel great, because that's part of the natural process. You're changing your body in any way. And I think doing something like an explant, where you had originally wanted to augment the breast and then reversing it, can have a lot of fears around it. But going to the other side of the surgery, I felt like reborn.
Yeah, good. Good to hear that actually. So how about the feelings, like, how about the sensation? And this may be a really big question from ladies. So
It's true, you don't want to lose the sensation. So actually from the first day after the surgery, I had sensations. So I could feel my nipples still. I think you asked me to do it.
yeah,
The test, and yeah, it was fine. In terms of the sense of touch, my breasts feel the same. Like, actually, maybe it feels slightly, I think maybe I feel slightly more sensation, not on the outside, but more within, because which might make sense. I don't know, I'm just thinking of this now, but because there's not something in there blocking it. But yeah, the outside, the nipple, all that area, there's sensations. I didn't have any issues and it's all good, so.
Yeah, we mostly expect this, but still a numbness may be an issue after the surgery, but this is rarely permanent, very rarely. So we can expect a little bit hypersensitivity sometimes numbness, sometimes tinglings, but finally it comes back. But you were like on the much more lucky side with the others, and you were directly feeling this.
Yeah.
This is an important question. That's why I was asking about that.
No, it's a good point. I think it might have, I do think it was maybe a little bit more sensitive for maybe a couple of weeks only, but not much to even know. Overall, for me, yeah, I was lucky. It was pretty good.
Yeah, perfect. So you are able to come back to your daily life in a short time, but it's better to describe the feelings about turning back to daily life.
Yeah, so I think altogether, and a lot of other women have asked me this too, what is the recovery process like? I think the first couple of days after surgery, it's hard, but you've been through a procedure, you've been under general, like you're just not gonna feel your best. But by about 5 days later, and then by a week, I was, feeling really good. I was back walking around doing things.
Eating some kebab.
Yeah, exploring Istanbul, which was really fun. It's actually such a nice place to have that first bit of recovery, because you can go and do all these like fun things as a tourist, and whatever procedure you're having, you don't need to worry, because there's so many other people there walking around with procedures, in the post-op period, so you will not feel weird. I really had a great time, and I felt good. I didn't have a lot of pain. Obviously, you gave me medication in case I was feeling pain, but I found altogether after the surgery there wasn't much pain. And I don't know if this is typical of the
Yeah, for this type of
wasn't
a
too-
surgery, we don't usually expect much pain. Up to the stitches of the muscle, sometimes you may feel the pain when you are moving your shoulder, especially, but I cannot classify this surgery as a painful surgery.
Yeah, it was definitely good. I think the biggest thing was just getting to that day. That was the most challenging part, was the mental part of getting there. In terms of the explant surgery itself, once I had it, it was all, easier and downhill from there. You were checking every 1 to 2 days to make sure that the fat was not moving anywhere, and that everything looked good.
No infection.
Yeah, no infection. So I felt like really secure that everything was going well. And I was a good patient. I kept my compression bra on at all times, which in the end is it 6 weeks I was wearing US bra? Yeah.
Usually at least 4 to 6 weeks is
I did for 6. I think I went for the mat because I'm in case.
As you can see, there are some homeworks after the surgery, like wearing the garments like bras, using some tapes, and some wound care details may be an issue for you. So you also had some homework, because the healing process is as important as the surgery. So the surgery makes everything in structure, but the healing process decides some of the final results. So these are really important details.
Yeah, and I also just doing the things like, making sure your body stays hydrated, having good nutrition. I really paid attention with all of that, which I'm sure would have helped with my recovery. Something I also really loved is that in the sort of kit you provide your patients post-operation, there is a sort of natural anti-inflammatory supplement. And because I know a lot about sort of these health things, when I saw this, you know what I'm talking about? What's it called? Yeah, it's got natural ingredients, like a supplement to help with the inflammation in your body. And I was really impressed that they were including this in there with the like pharmaceutical medications.
Yeah, actually, we need to take some details from the nature. So these kind of supplements are always useful. So this is not only antibiotics and the painkillers, also we can use the anti-inflammatory supports. So they must be researched, of course. We won't directly take it from the nature and beauty. It must be also safe. So yeah, these are some details about the healing process.
Yeah. And that's a nice thing. You do get everything that you need. You provided me with that, Renee Clinic did, from the beginning till, right into the post-operative care, which made the whole thing really easy.
Yeah, perfect. So, and do you want to tell anything as an extra for other patients, maybe who want to get this type of a surgery or any other surgical experience with us?
Yeah, sure. I would say that if you've been wanting to do an explant procedure for whatever reason and you're being held back by, the fear of the procedure and what it could look like after, to just do your research and find a surgeon that you trust, because I'm sure you'll be able to end up with a result that you feel really happy and confident in, which was the beautiful experience I was able to have with Renee Clinic and with Dr. Yazgan. So thank you so much. I'm honestly so grateful. It's been, as I said, really life-changing for me to do this. And yeah, I'm so happy that I did. I'm so happy I found Renee. Happy I came on the journey to Istanbul to do it as well, which, yeah, was a really fun experience. And I can also say, like, the Turkish people are just such lovely, beautiful, welcoming people. I found that everywhere I went in Turkey as well. So yeah, it's a great country, great spot, and the medical prestige, it was really evident from the hospital to your clinic. Just everything felt, really 5-star. So my biggest thing, if you're considering explant and this is something you really want, to make it happen, because it can be really, really freeing to do that.
So we wanted to share her feelings for today and the process, because there are some surgeries and that people know very well what to do, what to expect, like breast implant and augmentation, and everybody knows the details about this regular surgery, but when we come to the explantation surgery, this is not that common. And most of the people want to get rid of their implants, but they don't know what to expect.
Yeah.
So I think this video will help them a lot. So thank you for all these informations and telling your feelings to our maybe next patients or all those ladies who want to get rid of these implants. So it's also good for me to hear all those good feelings during and after the surgery, and it's good to see you here again. So yeah, thank you so much. And yeah, we were talking about all the details about the breast explantation surgery and the odds and that you may have. So, and the most important thing is we have syphilis, and I think for those people who have different states, different size of implants or other problems maybe. So this is a customized surgery for all those ladies, and yeah, you may ask us or your doctor every detail after this video maybe. So make your consultations and ask for it, and expectations in the correct way, please. So yeah, thank you again.
Thank you.
Yeah. Obrigado.